Okay. So, you know how sometimes like you come across something in the news and it's like,
Yeah.
whoa, like
Mm.
this feels big. Like there's a lot more going on here
Yeah.
than meets the eye.
Absolutely.
So that's the feeling I got when I watched this video from the Ring of Fire. It's about some some big changes happening over at the Department of Health and Human Services.
You know,
HHS.
HHS, when you start hearing about like widespread personnel changes at an agency that's, you know, so vital to the health and well-being of everybody in the country, it's definitely worth a closer look.
Right.
Like what could be going on here and what are the potential downstream effects, you know?
Right. And the title of the video is Trump Cuts 10,000 Workers Responsible for Food Safety and Disease Research.
Hmm.
So right off the bat,
Okay.
they're setting a tone, but
Yeah.
the scale of what they're talking about here
Yeah.
is pretty massive. So they're reporting about 10,000 layoffs
Yeah.
at HHS.
Wow.
And then on top of that, another potential 10,000 people who've left through early retirement or voluntary separation programs.
Okay.
So if those numbers are even close to accurate,
Yeah.
we could be talking about HHS shrinking by almost a quarter of its workforce.
A reduction of that magnitude in a major federal agency like HHS would have huge implications.
Right.
Like we're talking about a major shift in how the agency operates and its capacity to carry out its responsibilities.
Yeah, for sure. And then there's this other little detail that they add in there.
Uh-huh.
They mention Robert F. Kennedy Jr., and they kind of refer to him as having a leadership role, but they don't say exactly what his affiliation with HHS is.
Right.
But he reportedly announces that a revolution has begun right around the same time as these changes.
Interesting.
So, it's a detail that they're using to kind of frame this whole narrative.
That timing with the revolution announcement and these personnel changes certainly raises questions about like what are the underlying drivers here?
Yeah.
And like what is the intended trajectory for HHS?
What are they thinking?
Yeah, like it suggests a deliberate reevaluation of priorities or operational strategies.
Yeah. Okay. So for this deep dive,
Okay.
we really want to get into the nitty-gritty of what this Ring of Fire video is reporting about these layoffs and these departures at HHS.
Okay.
So we want to understand, what types of jobs are affected, how these changes were carried out,
Right.
and what are the potential consequences, that they talk about.
Yeah.
The safety of our food and medicines,
Mhm.
our ability to research and respond to diseases, and even things like the regulation of tobacco and nicotine.
It's about examining the claims made in the video and understanding the potential significance of these changes within the context of public health and considering what this might mean for you, the listener, in terms of, the systems designed to protect your health and safety.
Right, exactly.
Yeah.
So let's start by looking at the kinds of workers that the video claims are being affected by these job cuts. So they're painting a picture of a pretty broad range of expertise being lost here. Scientists, doctors, researchers, data analysts, like all the kinds of professionals that you would think are crucial to maintaining a robust public health infrastructure.
Right.
And importantly, they specifically highlight people who are working on food safety,
Okay.
ensuring the safety of prescription drugs and regulating tobacco and nicotine products.
These are core functions of HHS.
Yeah.
For example, the FDA plays a vital role in overseeing the safety of our food supply and the efficacy and safety of medications.
Right.
And so losing personnel in these areas could impact the agency's ability to conduct inspections, analyze data related to foodborne illnesses or adverse drug events, and ensure compliance with safety regulations.
Yeah, makes sense.
And similarly, you've got researchers at the NIH who conduct critical work on understanding and combating diseases.
Right. And the way that these employees were reportedly informed of their job losses, according to the video, is pretty striking. So they describe some people receiving layoff notices via email at 5 a.m.,
Oh, wow.
which seems like a very impersonal way to deliver news like that.
Yeah.
But then, even more dramatically, they talk about employees arriving at their workplaces in D.C., Maryland, Atlanta, only to find that their security badges had been deactivated.
Oh, geez.
And they really emphasize that this happened to some long-term employees with no prior personal notification.
The way these separations were handled is definitely noteworthy, regardless of the reasons behind a workforce reduction.
Yeah.
How employees are treated during such a transition can have significant implications not only for those directly affected, but also for the morale and stability of the remaining workforce.
Right.
To learn of termination through a generic email or being denied access to the workplace without prior personal communication is, very abrupt and insensitive.
Yeah, the video uses terms like unprofessionalism and a lack of class to describe this process.
Yeah.
And you can kind of understand why if these accounts are accurate.
Yeah.
It paints a picture of like a really abrupt and maybe even kind of chaotic situation.
Beyond the immediate impact on the individuals involved, such an abrupt departure of a large number of employees could disrupt ongoing projects,
Right.
lead to a loss of institutional knowledge, and create challenges in maintaining continuity of operations within critical public health functions.
Yeah, so then the video goes on to talk about what they see as the potential consequences of these cuts for the health and safety of the public.
Right.
And this is where the level of concern really ramps up.
Mm-hmm.
They specifically mention worries about the impact on the ability to effectively review and respond to ongoing measles and bird flu outbreaks,
Okay.
both of which they say are currently happening.
These are public health issues that demand vigilance and a swift, well-coordinated response.
Right.
The CDC within HHS plays a key role in tracking infectious disease outbreaks like measles and monitoring emerging threats such as avian influenza, and a reduction in the number of scientists and public health experts at these agencies could strain their capacity to conduct surveillance, analyze data, and implement effective control measures to protect communities.
And they also raise concerns about the capacity to analyze food samples and manage recalls of contaminated products.
Yeah.
Like when salmonella is found in food.
Right.
This is something that affects everybody.
Absolutely. Maintaining a robust food safety system is essential to prevent foodborne illnesses.
Yeah.
The FDA relies on a skilled workforce to inspect food production facilities, analyze food samples for contaminants, and coordinate recalls when unsafe products are identified.
Right.
A significant reduction in this workforce could lead to delays in detecting and removing contaminated food from the market, increasing the risk of illness for consumers like you.
Right. So they then bring up Robert F. Kennedy Jr. again and his stated goal of making America healthy again.
Okay.
And they kind of question how you can achieve that goal by cutting so many people whose work is directly related to protecting public health.
That's the central tension highlighted by the source.
Yeah.
If the objective is to improve the health of the nation, then a substantial decrease in the number of professionals responsible for safeguarding our food and drugs. Monitoring and responding to diseases and regulating potentially harmful products seems contradictory.
Yeah, totally.
Yeah.
So that leads us to the perspective that they present in the video regarding the justification or what they see as the lack of justification for these cuts.
Oh, yeah.
They very strongly argue that there appears to be no rhyme or reason to what's happening.
They're pointing out that there's no clearly articulated and logical rationale for the scale and scope of these personnel reductions.
Yeah.
Without transparency regarding which specific roles are being eliminated and the reasons behind those decisions, it becomes really hard to understand the potential impact and to assess whether these cuts align with any stated strategic objectives for the agency.
Yeah, and they go on to say that these cuts don't seem to be based on typical justifications like eliminating redundant positions or addressing poor performance. Instead, they propose that maybe arbitrary numbers, like this figure of 10,000 layoffs, were just set without a proper assessment of the actual staffing needs.
That suggestion that arbitrary targets for personnel reduction were established without a thorough evaluation of the agency's operational requirements is a serious concern.
Yeah.
If accurate, such an approach could lead to critical shortages of expertise and capacity within HHS, ultimately undermining its ability to fulfill its vital mission of protecting and promoting public health.
And they're quite critical of the current administration's qualifications, implying that these kinds of decisions are a result of incompetence.
Okay.
Now, as always, we just want to remind you that we're reporting on the content of this video, and we're not here to endorse or refute any political opinions expressed within it.
It's important for you, the listener, to understand that the Ring of Fire video has a strong critical viewpoint regarding the motivations and capabilities of those overseeing these changes at HHS.
Right.
This perspective heavily shapes their interpretation of the events and their predicted outcomes.
All right, so to kind of wrap up the tone and perspective of this video, it's very clear that they have a strongly negative view of these layoffs and of the administration in general.
Mm-hmm.
The language that they use is often very impassioned and critical and, conveying a sense of urgency and alarm.
Yeah, the video definitely communicates a significant level of concern about the potential ramifications of these actions at HHS. The overall tone suggests a deep worry about the future of public health and the safety of consumers across the country.
And they conclude with a pretty stark prediction. They state that this situation is going to be a disaster for consumers across this country.
Right. That final statement underscores the source's firm belief that the reduction in personnel at HHS will have widespread and negative consequences for the health and well-being of the general population.
So to bring it all together, this deep dive into the Ring of Fire video highlights a reported significant reduction in staff at HHS,
Yeah.
potentially around 20,000 individuals, through layoffs and voluntary departures. And the video expresses serious concerns that this could negatively impact essential public health functions, such as monitoring and responding to disease outbreaks, ensuring the safety of our food supply and our medications, and regulating things like tobacco.
Yeah, and they also point to the abrupt and impersonal manner in which some of these job losses were communicated, describing it as unprofessional,
Right.
and arguing that there doesn't appear to be a clear and logical justification for the extent of these cuts, suggesting that they might be arbitrary and not based on a thorough assessment of the agency's needs.
And their overall perspective is one of deep skepticism and significant concern, predicting potentially severe negative consequences for the health and safety of the public.
Considering this information, it prompts a really important question for you, the listener. With such significant personnel changes occurring within a vital public health agency like HHS, what do you see as the most critical aspects of our public health infrastructure that require strong and sustained support and expertise? What potential long-term implications could a large-scale reduction in staff have for the systems designed to protect your health and the well-being of the nation?
Definitely something to think about.
It's worth considering carefully.